Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. We are fresh off of our December Innovator Summit, so wanted to share one quick announcement, which is that we have our next Innovator Summit coming up in the new year in May of next year, and tickets for those are officially open. So make sure that you sign up ahead of time so that you can attend this incredible event. And with that, would like to formally introduce our guest for today, HITLAB's own. We have Amy West, who's the Principal Director of Advisory Services, and Charul Narain, who is the Strategy Associate here at HITLAB. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Amy or for Charul, make sure you use the Q&A feature or the chat, and I will make sure that we get to it. With that, thank you so much for being here today.
Thanks for having us. And I want to apologize in advance. I'm dealing with a bit of a cold, so my voice is a little scratchy. So sorry about that.
It's that time of year for sure.
Yes, it is. And we're coming off the summit last week. There was a lot of talking going on.
That's right. Makes a lot of sense. Speaking of the summit, I have so many questions to really pepper you both with. But I think before I do that, would love if maybe you can do a quick introduction or a background for our audience today. Amy, maybe we can start with you.
Sure. So Amy West, I'm a principal of the advisory services at HITLAB, where we are looking to support those in the health tech space with strategic direction and advisement based on the needs of their organization and what they're looking to do relative to partnering, engaging, or testing or scaling the offerings that they have. And so again, working with these organizations to really get them on a trajectory to be accessible, throughout the market.
That's incredible. Awesome. And Charles, would love if you could share a little bit more about you.
For sure. So I'm Charul Narain. I am the strategy associate at HITLAB, really helping to work within the advisory services to work with all the clients that we have in terms of all the startups, trying to figure out their go-to-market strategy, their product market fit. And prior to that, I recently graduated as a Master's of Public Health student from Columbia University. And yeah, like really interested in the intersection of healthcare and business. And I think HitLab is the perfect place to kind of learn about that and go about it in the best way.
That's incredible. And I think on that note, really hearing what you both are speaking of when it comes to really supporting these startups, supporting organizations that are doing incredible work kind of within the broader health and technology space. Would love if you could share and dive in a little bit more of just what you both have been seeing, right? Being in the advisory space. And maybe, Amy, we can start with you. Would love if you can kind of give us some insight into what are some of the key challenges that you're really seeing when it comes to the advisory services when working with startups. Are there kind of a couple of core challenges that you're finding startups really having to navigate in this space?
Yeah, I mean, there are a lot. And, when I think about what we're doing with women's health in particular, the women's health tech space, I think we have some additional unique challenges. If you look at healthcare in general and investment in women's health, there is really a paucity of investment in women's health tech. Really, only about 1 to 2% of total health technology funding is going there, which is really, really small. And between 2011 and 2021, only 4% of new medical technology drugs relating to female-specific health conditions were approved in the U.S. So you've got a funding issue, but you've also got a gender bias issue in the funding. So this is another area that's a real challenge as we think about women's health tech in particular. So I think that why are we seeing that? And these are also things that we are hearing from some of the women's health tech startups that we're working with. I think one of the reasons is that there is a perception that these women's health technologies might be considered niche rather than having a broad market appeal, which leads investors and partners to concern about potential return on their investment. And it's really sad to hear that, because women make up 51% of the world, and so we are not a niche market, but that is a perception, and perception is reality. Another thing that we hear is that the space that you're playing in, oftentimes in the fertility space, is that it's a crowded market. Fertility, maternal care, and it's possible that could be the case, but that's where it's really important. This is where we advise our partners that we work with. It's really important to define where you're playing and what your value proposition is, because there's a perception that everything gets lumped together, and that might not be the case. So it's really important, as you're putting your planning together, your positioning together, or your pitch decks, that you're very clear and that you have the evidence to support that you are not a crowded marketplace and that you are not a niche player as well.
That is incredibly helpful. And I think on that note, you did an incredible job just kind of outlining some of the foundational challenges that many startups kind of operating in the women's health space are dealing with. But on that note, how is HITLAB really tailoring the advisory services to help kind of meet those unique needs and to help founders navigate these challenges?
Sure. And so we do this for all of our sponsors that we work with, whether it's women's health tech or not in the women's health tech space, but all the organizations and sponsors that we work with through advisory services. We partner with them to really create that holistic view of the entire value chain. And based on the work and the solution that they have, we work them to understand how to best position their offering in the market, which customers or partners should they engage with based on their needs, based on the customer or the other stakeholder needs, and what is the benefit and the value to those stakeholders. We know you have a solution that works. We've worked with you to generate that evidence through our lab, for example, but if you haven't positioned it properly in the market across the value chain with an end user who needs it, wants it, that's great. But someone also has to be willing to pay for it in order for this to be a scalable, investable model. So we work really, really carefully on some of these fundamental considerations and positionings to make sure that what we're proposing is going to be sustainable, investable, and scalable. And that's really, really important. So, that turns into specifically, pitch decks. Charul mentioned that early on, pitch decks, go-to-market planning, financial modeling considerations as you're thinking about, investment opportunities, and then networking with potential stakeholders or players in the value chain that are going to be really important for you in order to be able to prove out your model and get it scaled across the organization. Because the goal here really is to enable them to be positioned to scale the solution.
That is incredibly helpful. And it seems like, really kind of multifaceted when it comes to the approach of continuing to support these founders. And I think, Charles, you had kind of mentioned too some of the work that you've been doing, kind of like that client-facing side with, all of the various tools and things that you have in your back pocket. Would love if you could also share some more around the experiences or the challenges that you've kind of encountered when supporting startups or organizations.
For sure. I would say really achieving a product market fit sometimes can be a challenge. You have a lot of these individuals who are super passionate about the product it is that they're working on, but also at the same time making sure that you find a balance with validating it with their target audience, right? So that it can even include like making sure that we have a tailored target audience in the first place. A lack of that can result in a lack of customer engagement, and that's kind of counterintuitive, because at the end of the day, you're trying to solve a problem, and the people that you're trying to solve that problem for are crucial to be included in actually making sure that that gap is being reached, or if their needs are being met. So we really try at HITLAB, specifically within the advisory service, to stress the importance of early prototyping, making sure we have feedback loops and just iterations that really keep the target audience in mind, and really try and engage them in every step of the way when you're creating on this product journey.
Yeah, that's incredibly helpful. And it sounds like that obviously is such like a core component when it comes to really like the lifeblood of a company. I think on that note, there's so much that's been done that you all are kind of speaking to when it comes to the advisory services and the ways that HITLAB is supporting startups and organizations, but there's also so many other, programs and aspects of HITLAB. And I really would love to learn more. And maybe Amy, you may kind of have the key to this, but can you tell me a little bit more around Women's Health Tech Initiative? How did that come about? What are its primary goals? Any of that information would be awesome to hear.
Sure. I mean, it kind of goes back to some of the challenges that we talked about at the very top of the conversation, that, women make up over half of the world's population, 51%. But for too long, a lack of timely research and data on women's health have really put us in a situation where like healthcare providers don't have the important tools that they need to diagnose and treat the millions of women with debilitating conditions. And oftentimes when we think about women's health, we're thinking about fertility, menopause, those types of areas. And those are really important, and those are key to women's health. But we also haven't done enough to understand the implications for cardiovascular health, Alzheimer's disease, autoimmune diseases, mental health conditions. And there's just such a broad area that we don't know enough about because of the way the research has been conducted over the years. And there's really just been this underinvestment in women's health and understanding, how our hormones and our biologies are made up and what those implications are. Obviously, there are a lot of negative health implications to that, clearly. But underinvesting in women's health research also can decrease women's well-being and quality of life and hold us back in the workplace because of that, and also affect our families and our economic security, because women, the mothers, the women in the household tend to be the chief sort of medical officers of their families. So it's impacting more than just women. It's impacting our communities. But in contrast, if we can increase investment, in women's health research, we can yield significant gains for women, societal gains across the board, including lower healthcare costs and more productive and inclusive workforce. So it just has vast benefits. And that's really why I think it was back in 2018 that the HITLAB established Women's Health Tech Initiative to really address this and, look at these pervasive gaps in our knowledge of women's health and shine a light on it and accelerate research on the unique health needs of women across their lifespans. Our mission as the Women's Health Tech Initiative is really to inspire and accelerate the diffusion of innovative technologies that address unmet needs in women's health with evidence. And so we believe, again, that if we can do this the right way and get more people to engage, it has huge, significant societal and global benefits.
That is incredible. And I could only imagine, I didn't realize that it was founded in 2018. So I could only imagine all of the incredible, companies that you've seen be a part of this initiative. I know there's probably so many, but if you can share at least a couple of just really exciting innovations that you've kind of seen emerge through the Women's Health Tech Initiative.
Sure. So one of the things that we do through the Women's Health Tech Initiative is we issue a challenge every year. Excuse me. And To your point, there are many amazing women's health tech companies that have come through. And I'd also just like to add, excuse me, that the women's health tech, they don't have to be women founded either. Anybody playing in this space, it's not, it doesn't have to just be a women's sort of led company. We definitely support those, but it can also be, men involved as well that are really looking to drive change. And so I would highlight two winners that we had coming out of this year's Women's Health Tech Challenge. One was OsteoBoost, which came from Bone Health Technologies. And OsteoBoost is a vibration therapy that's designed to defend against osteoporosis and osteopenia. It is not a drug, and it's the first FDA-cleared drug-free prescription treatment for osteopenia in postmenopausal women. So that's a huge breakthrough, because usually when you think about osteoporosis, it's it's a pharmacotherapy type of intervention. And so this is a really innovative approach that hasn't been FDA cleared, which is really exciting. And then another good example, I think, speaks to the global reach of this challenge, because we issue it globally. And one of our winners in the nonprofit space was called Maisha Meds. And Maisha Meds is an African healthcare technology company which is looking to transform the quality and affordability of care at that last minute mile through pharmacies and clinics that are the first and many times the only point of care for a majority of patients, particularly women, in some of the African states. It's a mobile app that they've created. Through this app, they've created a digital network of more than 4,100 facilities across Kenya, Tanzania, Uganda, Nigeria, and Zambia. It is the largest network of its kind in these countries and enables more than 1.6 million patient visits per month. And they've also directly reimbursed over 700,000 patients to date for quality assured malaria, HIV, family planning, vision care, and a number of other conditions. And a majority of those are impacting women. So I think those are two great examples of some really innovative approaches to supporting, interventions, support, and ways to hopefully prevent or minimize disease progression.
Absolutely. That sounds incredible. Both of those companies, I mean, I can only imagine the type of impact when it comes to these types of breakthroughs. And you had mentioned this, Amy, kind of really speaking to the global aspect. And so I'm so curious. I mean, there's that kind of component is probably one of so many when it comes to, really would love to learn a little bit more around how Women's Health Tech Initiative is really engaging with these diverse communities. It seems like that's a kind of a big area of focus to really make sure that we have that global reach or kind of diverse voices. So would love to learn a little bit more about that too.
Exactly. I mean, I think a lot of the Women's Health Tech Initiative is designed to really look at some of the health equity challenges or health disparity challenges that we have within women's health. And again, as we talked earlier, the importance of making sure that women are healthy. It's so important because it trickles through to the families, to the communities, and to the global environment. So the global reach is really critical. And again, the example I shared about Maisha Health, I mean, when we do our challenges, we cast a broad net globally, and we get submissions across basically all continents outside of Antarctica. So we are getting a lot of engagement because there's a lot of need. I would say too, what kind of an interesting consideration too, it's, in working with a lot of these organizations, we obviously are looking to support them with our expertise and the insights that we have. But there's almost this equal exchange of insights and expertise that we receive from them. And we take that learning and we're able to share it. That just goes into our repository of understanding and experience, and also to support our network. So then we can start to even have some cross collaboration going on, because different countries and different communities are going to have different needs. But how can we apply the learnings in one space and potentially transfer and leverage it somewhere else? So it really is a really nice dynamic and a way to learn from each other and how we can better serve and invest in women's health tech and serve our communities.
That's incredible. And I love that it seems like that, was just very intentional and really kind of woven through the foundation of this initiative. And I think on that note, and Charles, would love to learn kind of from your perspective. I think Amy was really speaking to just the network and how that is so kind of really, really foundational. And I think collaboration is also a really huge part of that. Kind of from your perspective, what role does kind of collaboration play, whether it's, the various stakeholders, providers, startups, researchers, beyond? How does that kind of all work together to, play the successful role in the women's health tech initiatives?
For sure. And honestly, I think collaboration is super, super important. Just this idea of teamwork and building on each other's ideas. And I think the Women's Health Tech Initiative hinges on the ability of startups, researchers, and providers, and several other stakeholders to really provide a platform to collaborate and just like communicate their ideas. Honestly, everyone brings something to the table, and you can really see it all come together. You have startups that bring innovation and agility, researchers that provide their scientific insights and data validation, which is incredibly important. And then you have healthcare providers that make sure that solutions that are brought to the table are clinically relevant and patient-centered, because obviously you don't want to have a solution, like I said previously, that doesn't keep the target audience in mind. So everyone really works together to, build on each other's ideas, and also really just find ways to improve. And I think at the end of the day, that's kind of where the Women's Health Tech Initiative thrives, bringing that sense of community, and I guess in a way a safe space where people can share their ideas, and then different stakeholders can work to really bridge a gap that is kind of identified. So bridging that gap between research and real world application. You can have a lot of research, you can have a lot of data, but at the end of the day, it needs to be brought over to the side where people are able to utilize and use that solution. So I think that is kind of where collaboration's incredibly important. And then you create solutions that are effective but also scalable.
100%. And I think, Charles, that's a great segue, because I also really wanted to ask you both about the Innovator Summit that was, just right around the corner. And I think, one of the beauties of around these types of events is kind of being able to bridge those gaps and kind of elevate and provide these platforms. And so maybe, Amy, we can start with you. Would love if you could share a little bit more around the summit, and really how it is kind of leveraged to elevate and kind of be that platform for kind of everyone that's involved, from startups and entrepreneurs to industry experts and beyond.
Sure, and I think Charles did a really great job to highlight the the collaboration that's required for all of this. As I always say, you can't do it alone. We have to work together in order to do that, and that's really a lot of the essence of what the HITLAB brings. It's about bringing the different stakeholders from different aspects of healthcare together, whether it's clinicians, health systems, life sciences companies, the entrepreneurs and the engineers and the scientists playing in the startup space, as well as the investment community, whether they're venture funds or angel investors or what have you. But the summits are very, very curated groups of people that come together to share their stories, their successes, their learnings, and how they might be able to work together. And we have a lot of networking that goes on throughout the sessions. We always have keynotes and panels and speakers, but there's a lot of networking involved as well. We're very intentional about creating that space and that time to have those conversations, because that's a lot of what people are looking for, especially in the startup space. These are smaller organizations that have an amazing opportunity, a great solution that has been proven. Now you need to get the investment to get it off the ground. And so it's critically important we bring these people together so they can share their stories and test and learn together. And I think we had some really great examples that were actually showcased at the event, highlighting actual collaborations and partnerships that transpired coming out of even last year's summit.
Wow.
For example, when we think about women's health, there's an organization, a startup called BirthView, which is a digital labor companion for moms. And at last year's event, BirthView was a featured speaker and has been a part of our challenges. He actually, Rashawn, who is sort of the founder of the company, actually met someone at the conference last year who became his CEO. And we got to highlight their relationship and their collaboration this year. And that was not the only collaboration that was highlighted. We also had an example, not necessarily in the women's health tech space, but SUNY Downstate hospital system connected with a startup last year called Twig Health, which was a telehealth platform that is supported with live nursing support as well as enhanced AI support. So a very scalable solution. But they met last year and agreed to test working together in a very managed pilot situation, which ended up being very successful. And they've continued to scale from there and build out their collaboration. But again, another highlight that a use case study that was showcased at the event. Again, this came about because people came together at last year's summit. And it makes me really excited to see what we might hear about at next year's summit, this time next year, because this synergy is what these events are all about. And it's nice to see that it's actually really proving out to be very successful and scalable.
That's incredible. It's like it's giving like matchmaking energy when it comes to a lot of these types of things, which is incredible to see and to really actually see the progression of these stories. Really wanted to ask, I know we're so close to time, but Charul, really wanted to get your perspective for any, grad students or, new grads who are listening today. As a recent graduate yourself, what was kind of your perspective of the, Innovator Summit and kind of these types of events for you?
For sure. I think Amy really highlights this aspect of networking. Honestly, it sounds a little cheesy, but it really is. Going to these summits is kind of like a source of inspiration of like really seeing key players within the ecosystem, taking the charge to find solutions. And then, you have investors and other leaders within the life sciences industry that kind of help to facilitate the process of bringing that to the market. And I think there's also just this idea of like, okay, you really see in real time the applicability of these solutions. A lot of the times you do there's a lot of research that kind of happens within academic institutions, and that there's, in my opinion, I feel like there's a delay in its ability to actually be sourced into real world situations. So when you have summits like this, you're really able to see, okay, like this is a problem that we know is current within the global healthcare systems that may be. But then these are also solutions that are actually happening as of right now, as we speak, to address those problems. And I think that is really, really important. And I think that leads and really emphasizes the importance of innovation.
That is incredible. And what a beautiful way to end, I think, as well. Thank you. Thank you so much, you two, Amy and Charles, for such an incredible conversation. It's always amazing to learn a little bit more about the inner workings of HITLAB and all of the incredible work that's being done to support not only startups, but just the broader ecosystem at large. So thank you both for joining and sharing more about your insights today.
Super. Thanks, Nina.
Thank you both. Make sure you join us next week for our next Women's Health Tech Wednesdays. Wanted to thank our amazing sponsors for this conversation, as well as Amy and Charul, and we will see you all next Wednesday. Bye, everyone.